Good morning, everybody. I'm going to present an impact evaluation of a training program on drug policy, HIV, and human rights in my region, in Latin America. I share this presentation with my colleagues Pablo Zimmerman and Maria Eugenia D'Agostino. In most countries, as you know, people who use illicit drugs often face harassment, discrimination, and abuse. Most incidents go unreported or are justified by arguments such as the incapacity or the danger of drug users who are blamed for the abuse they suffer. Prohibitionist drug policy generates human rights violations that contribute to vulnerability to HIV infection among drug users. In order to promote advocacy efforts in Latin America, Intercambios Civil Association, an Argentine NGO based in Buenos Aires City, developed an online training program. Drug Policy, HIV, and Human Rights, Contributions for Reflection and Action is a virtual course 2 months long, developed in collaboration with Punto Seguido, an Argentine NGO specialized in education. The course is aimed to activists and professionals who work with public policy and practices in drugs and HIV issues, as well as those people interested in drug problems from a human rights perspective. The proposal is based on the need to question the current global approach to drugs in order to improve the responses. The course objectives are provide a general framework of knowledge about the international and regional mechanisms for human rights protection, analyze the convergence and divergence between drug policy and the international human rights system, offer evidence of drug policy impacts on drug users' criminalization, health, and HIV and hepatitis epidemics, identify human rights violations in drug-related situations, and provide tools for the development of human rights-based programs and advocacy actions. Key topics covered in this course include stigma and discrimination, introduction to human rights, United Nations and Inter-American drug control and human rights system, impact of drug policy on the criminalization of drug users, on their health and social situation, on HIV and hepatitis epidemics, identification of human rights violations, and advocacy strategies and tools. The virtual campus offers mentoring, internal mail, discussion forums, virtual library, videos, and virtual coffee room. 8 classes are displayed at a weekly basis. Supplementary materials are available at the virtual library. An online debate forum allows participants to exchange experience, doubts, and contents discussion. Students are invited to develop an advocacy proposal as closing and evaluation activity. With the support of Open Society Foundations and Levi-Strauss Foundation, a scholarship program for Latin American applicants is offered to promote awareness and networking among civil society representatives and public officials from healthcare, justice, social development, and education system. Between 2010 and 2012, 6 courses were held with 477 participants, 89% of which were awarded scholarships. In 2013, an evaluation was conducted to assess the achievement of the training objective and its contribution to new advocacy initiatives. A random sample of 95 participants, 20% of the total, was selected to autocomplete a survey. More than 50% of respondents were young people under 35 years old. There was a wide range of professional backgrounds, with 28% coming from the mental health field. They were distributed in 16 Latin American countries. 50% live in Argentina, Uruguay, Colombia, and Mexico. 48% were governmental officials, 27% civil society representatives, and 17% academics. The following introduction remarks show how diverse the groups were. For instance, Lucila from Uruguay said, "I'm a member of the team involved in human rights education for military staff at the Defense Ministry. The course helped me to improve my work." I was a drug user for many years. Currently, I conduct a referral center. I am very motivated with this course because discrimination is a real fact in my country, said Rodi from Panama. I'm a lawyer and I coordinate the legal area of an LGBT NGO. I use this course contents to benefit the people I work with, said Gustavo from Argentina. I work at the penitentiary system. I'm glad to participate in this course and improve my performance, said Karen from Guatemala. Regarding the course evaluation, 88% of respondents answered the course had fully fulfilled their interest and expectations, and now 91% considered its contents were very good. This course has helped me to get scientific evidence to improve drug users' quality of life, said Gail from Mexico. The lessons have been very interesting as knowing experience and opinions of the rest of the group as well. I took a great deal of reflections on these issues, said Juan from Argentina. Regarding its utility, 89% answered the course had contributed to their performance. Contributions were mostly described as new approaches, 29%, inputs for intervention, 12%, and legal information, 10%. The course gave me many tools for action and new ways to think on these problems, said Rodrigo from Chile. 65% admit changes in their everyday practices. 42% had changed the way they perceived drug problems. 15% said they had gained better understanding on drug users' situation, and 7% had redesigned projects or activities they were undertaking. This course has helped me to see things I had in front of my eyes and I have never noticed, said Carlos from Ecuador. 53% said that they had undertaken a new activity as a result of the course. The foundation of an NGO devoted to drug policy reform in Costa Rica, the launching of a certification program on drug policy and human rights at the Bolivian University, and the inclusion of an advocacy lesson in a course for public health stakeholders organized by the Pan American Health Organization were among these new initiatives. It was my pleasure to take this course. It will benefit a lot the population I represent, said Federico from Colombia. Lastly, students were asked if they knew other training offers on drug policy, HIV, and human rights in Latin America, and 83% answered they knew no other training opportunity on these issues in the region. This indicates the need of this kind of training, particularly a virtual one, because of its accessibility for professionals and activists living in very different environments. 92% said they would recommend the program to a colleague. As a public defender, this course was of great interest because most of my clients are drug users, said Cecilia from Uruguay. Among the main lessons learned, we would point out that challenging common misconceptions about drug users was well received by participants of the training program as a key tool to build a more balanced discourse centered in public health and human rights. 1/3 of respondents considered that the course offered a new approach, and 42% recognized the change of their perception as the major outcome. Moreover, training continuity is a key component to sustain advocacy efforts articulated with research and intervention initiatives. In order to improve comprehensive responses to drug issues, a critical mass of key stakeholders trained and committed to drug policy reform needs to be strengthened. Our next steps intend to complement capacity building with networking and partnership, and seek for more commitment from local authorities in order to help generate changes in the interventions of the field workers as well as in the programming decisions. Thank you for your attention.